Hello, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I will talk about part 2 of 3 of our vaccine series. We will go through the National Immunization Program, the NIP, and the recent changes that have occurred. Now, what is the NIP? The NIP stands for the National Immunization Program in Malaysia. It started in the 1950s and it consists of a list of recommended vaccinations or routine vaccinations for children which must be taken without exception. The vaccinations are provided for free and is available at all government hospitals and selected government clinics or klinik kesihatan. Why are some of the vaccines not offered on the NIP? Are these optional vaccines not good or second grade? Actually, all vaccines that are manufactured are to protect against serious diseases. So no vaccine is second grade or not good. The reason some of these vaccines are not included in the NIP is because of budget reasons. In fact, one of the previously optional vaccines, called the pneumococcal vaccine, was recruited in the NIP recently. We hope that in future, our government will be able to allocate enough funds so that all available vaccines are given to every child in Malaysia. What are the recent changes in the NIP? In light of the recent changes in our country's NIP, many parents have questions regarding these changes and whether they will impact their older children. So the first change is the MOH will be switching over to the 6-in-1 vaccine. 6-in-1 includes the diphtheria, tetanus, pertussis, Haemophilus influenza, polio, and hepatitis B combination vaccine from the 5-in-1 vaccine. The 5-in-1 includes all of the above except for hepatitis B, starting at 6 weeks old. In the past, the hepatitis B vaccine was a separate jab. This change will reduce the number of pokes or injections that the baby will get. Another change is that the NIP will include the pneumococcal vaccine starting at age 4 months for a total of 3 doses of the 10-strain pneumococcal vaccine. Will my child, who is already more than 6 months old, have less coverage due to the change in the 6-in-1 vaccine? No, it is similar in immunity and coverage. In fact, in the past, the hepatitis B vaccine was given as a separate jab. It was given though. So in the end, all children should receive at least a total of 3 doses of hepatitis B vaccine to provide lifelong immunity. Is the new vaccine schedule safe? Yes, it is. With the new vaccine schedule, there will be more hepatitis B doses. However, studies have shown that with just a minimum of 3 doses of hepatitis B vaccine should be enough to confer lifelong immunity. More doses do not seem to offer more protection, nor does it cause more side effects. Basically, long story short is that it is safe. Also, with the 6-in-1 vaccine, it reduces the number of times the baby is injected or poked, and also the number of visits to the clinic, which helps with the parents not having to take time off to see the doctor, which is a good thing. Now, the 6-in-1 vaccine is not new. It has been used by private pediatricians for a long time now, and it has a very good safety profile. What about the pneumococcal vaccine? Is it safe and does it offer enough protection? With the NIP's adoption of the Synflorix 10-strain pneumococcal vaccine, this is a welcome move for all citizens of Malaysia, as the pneumococcal vaccine protects your child from invasive pneumococcal disease, which can affect the lungs, brain, and blood. It is a reputable vaccine with a good safety profile and has been in use since more than a decade ago. However, the NIP only offers a 3-dose regime as opposed to the intended 4-dose regime. Another thing to note, Synflorix, the pneumococcal vaccine that the NIP uses, contains 10 strains of the pneumococcal bacteria, whereas another brand in the market
contains 13 strains.
of the bacteria, which may offer slightly more coverage. So, although it is great news that the NIP has adopted the pneumococcal vaccine, it is a 3-dose regime. 3 is still better than none. However, it is still preferable to have the 4-dose regime, which will offer a better protection. You may ask your doctor about possibly getting an extra dose of the pneumococcal vaccine in a private clinic at 2 months old, and then continuing the NIP program at the government clinic. That is absolutely safe to do so. If you prefer to have your pneumococcal vaccine done at the private clinics, do remember to ask your doctor about the differences between the 2 types of pneumococcal vaccines out there, which might make you have a better, more informed decision on which pneumococcal vaccine to take. Thank you for watching.